Hey interns, it's Dr. Chris, orthopedic surgeon and sports medicine physician, and today I'm reacting to Chuma Okeke's injury.
Switching out front right now on the cuts.
Yesterday, I had just posted a video on Yusuf Nurkic and the injury that he suffered earlier this week. I was reading through the comments, and wouldn't you know, somebody says to me, you should react to Chuma Okeke, and I'm like, what are you talking about? So I checked him out on YouTube. Lo and behold, last night, Chuma Okeke suffers an injury.
Right now on the cuts.
We're gonna review that bad boy. We're gonna get it done. So the first thing I gotta say is thank you to Lucas Woodward for giving me the tip. So let's check it out. So we have Auburn playing North Carolina as part of March Madness. Chuma Okeke driving to the key. And as he cuts to the hoop just below the basket, something happens and he just kind of falls to the ground. And we can't really see exactly what happens from this view, but we can see that he grabs his knee. So now we have a view right from the baseline, right below the basket. And we can see Chuma Okeke driving towards us head on. He kind of plants his left leg to drive in towards the hoop, but when he plants his left foot, you can see that his knee buckles and he falls to the ground.
Left leg just buckled on him.
So there are a few things to note about this. There is not really a big collision which has thrown him off balance. The second thing to notice is the position of his body relative to the foot that he has planted. And you can see that he plants his left foot on the ground, but while he does so, because he is being guarded, his body position is behind his foot and falling back towards the left-hand side. The third thing to notice, when we consider the relative positions of his center of gravity, the knee, and the foot, we can see that his knee has been subjected to load when it is in a valgus position. Valgus here meaning knee is towards the inside rather than varus, which would be the knee towards the outside. When the knee is in this position, there is a high likelihood of injury to the anterior cruciate ligament. The anterior cruciate ligament is commonly injured when there is a valgus stress to the knee and an external rotation force applied to the foot. Quite frequently, this does not occur in isolation. This may also include the medial collateral ligament of the knee and also the medial meniscus. Quite often, these injuries will also be associated with bony contusions or bone bruises to the femoral condyles or the tibial plateau as the joint opens and closes with the rotation mechanism. From my perspective, this is an anterior cruciate ligament until proven otherwise. So once we return to the video, we can see here that eventually Chuma Okeke is able to walk off the court. And this is as we would expect after an anterior cruciate ligament injury. He should be able to walk with some assistance, although his knee is going to become progressively more and more swollen and progressively more and more stiff. In the very short term, he's going to have quite a bit of pain. We are going to obtain an MRI or magnetic resonance imaging of his knee so that we can see what other structures have been damaged. Once the diagnosis has been confirmed, then we are going to decide, is this something that we are going to treat non-operatively or operatively? Ultimately, this is a question that needs to be determined between you and your treating surgeon or your treating physician. The data on this is variable. With some studies showing there is no difference in the long term between people who have undergone ACL reconstruction and those who have not, while other studies show that patients who have undergone ACL reconstruction have more favorable outcomes. But in the end, the decision of whether or not to have surgery is personal and dependent on each person's individual circumstances. In Chuma Okeke's case, because of the sport that he plays and the level at which he does so, I would venture to guess that if they confirm that this is an anterior cruciate ligament injury, he is going to go on to undergo an anterior cruciate ligament reconstruction surgery. And once this has been performed, he will have to undergo extensive rehabilitation of his knee afterwards. Everybody thinks that they're Adrian Peterson, and they think that they'll be able to return to sport at a high level within 4 to 5 months. Studies now, however, are suggesting that patients need to rehabilitate anywhere from 1 to 2 years following an anterior cruciate ligament reconstruction before they are ready to play sport at a level similar to that at which they were playing at the time of their injury. Somehow I don't think that's going to happen for him. If it's an anterior cruciate ligament injury, I suspect that he's going to be out for at least 6 months to a year. So some of you might ask, is there anything that Chuma could have done to avoid this? There are a number of studies that show that with appropriate training in proprioception or body awareness, or training in jumping, landing, direction change, and cutting mechanics, the incidence of ACL injuries can be substantially reduced. And there are a number of resources that are available online to help you train for this adequately. You can look back to my own video, How Not to Tear Your ACL, or you can look online for the Melbourne 2.0 ACL Rehabilitation Guide. In addition, if you're looking for instruction on ways to incorporate some of these proprioceptive exercises into your warm-up or your preparation for your sport, you can look online for the FIFA 11 Plus Dynamic Warm-Up Protocol, which will show you exercises that you can include during your warm-up, will help to minimize the chances of you suffering an anterior cruciate ligament rupture during gameplay in the future. And although this guide has been designed for soccer, these exercises are not just for soccer. They're for any sport that involves jumping, cutting, twisting, pivoting, or direction change. Which injury do you think is worse? The injury that Chuma Okeke suffered, or the one that Jusuf Nurkic suffered? Jusuf Nurkic suffered a fracture, and although it's an open fracture, which carries with it a higher risk of complication, ultimately, he is going to undergo bone-to-bone healing. Chuma, on the other hand, is going to undergo tendon-to-bone healing. Since we don't really have good options at this point for ACL repair, we are going to have to remove the ACL ligament that he has, create bone tunnels on both the femur and the tibia, and we're going to have to harvest a tendon from somewhere else in his body, whether that be hamstring, patellar, or quadricep, in order to use as a graft to reconstruct the anterior cruciate ligament. The interface between the tendon and the bone is likely to be less strong than the bone-to-bone healing of a fracture. Were it me, I'd rather have Jusuf Nurkic's injury and get my leg broken, even if it was an open fracture. Best of luck to Chuma Okeke. I look forward to seeing him back on the court playing the sport that he loves.
Switching out front right now on the cuts.
So there you have it. I'm Dr. Chris, and I just broke down Chuma Okeke's injury. If you're new to the channel, be sure to subscribe and hit the notification bell so that you can be notified when we post new content. If you are a returning member of the intern army, you know what to do. Go hit the like button, share this bad boy with a friend. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Yeah.